Yeah, so stem cell treatments started off really in the 1970s as a result of radiation sickness and bone marrow failure. And since then, it has extended into bone marrow cancers and bone lymphomas and myelomas. And following that, stem cell treatments have also been done for patients with solid organ tumors in those which are chemo-responsive, like in germ cell tumors and Ewing sarcoma, as well as some immune-related disorders. So nowadays, majority of the stem cells actually are derived from the peripheral blood, where the donors undergo a process known as apheresis, whereby the blood is circulated into a stem cell collection machine and then returned back to them at the same time. And during this process, while the blood is in the machine filters out the stem cells and we collect stem cells that way. So this is a major step in the collection of stem cells because it eases the convenience of us collecting stem cells and also increases the safety for the donors to donate stem cells. So there are essentially two types of transplantation. One is allogenic, whereby the donor stem cells come from someone else, and autologous, whereby we use back the patient's own stem cells. Actually, if we want to cure patients with a stem cell therapy or stem cell transplantation, patients have to be in a good remission or a fairly good remission.
Haematology services in this hospital cover both benign and malignant disorders. Benign disorders include bleeding and clotting disorders, as well as inherited red cell disorders, nutritional anemias, as well as bone marrow failure syndromes. The malignant hematology disorders that we treat include lymphoid disorders, lymphoid cancers, bone marrow cancers, leukemias, and myelomas. Modern laboratory technologies like gene sequencing have become so important in the care of hematology patients. We not only use them for very accurate diagnosis, we also use these technologies to identify targets that we can use to help treat patients more effectively. And the availability of these services has really transformed how we look after our hematology patients. And the most exciting, newest form of immunotherapy is where we harvest the patient's own immune T cells and we modify them genetically. We give them a tool to enable them to recognize the tumor more effectively, and we give those cells back to the patient. So this is a chimeric antigen receptor T cell therapy that's already licensed for the treatment of lymphoma and myeloma, and extremely effective, more effective probably than the methods of treatment that we have currently today.